Good, happy Wednesday afternoon, April 15, 2020. I'm Riley King, and welcome to this afternoon edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this afternoon, so let's begin. First up, let's take a look at your COVID-19 in New Hampshire, what you need to know information. And here is that COVID-19 in New Hampshire, what you need to know. There are 1,091 number of people in New Hampshire who have tested positive for COVID-19. 586,377 number of people in the United States who have tested positive. 27 number of deaths from COVID-19 in New Hampshire. 163 number of people who have been hospitalized with COVID-19 in New Hampshire. And 23,649 number of deaths from COVID-19 in the United States. This map of New Hampshire shows where the cases of COVID-19 are in towns and cities in New Hampshire. There are 100 cases in Nashua. And this graph shows new cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. In the orange, new hospitalizations. And in the red are the deaths. And your common symptoms: fever, cough, and difficult breathing. How it spreads. And prevention tips. Be sure to stay with the Riley King Network for the latest of your COVID-19 information. For more deaths linked to COVID-19 outbreaks at long-term care facilities in New Hampshire, Sununu announces stipends program from frontline workers at long-term care facilities. Let's take a listen to that video.
These are truly challenging times, but New Hampshire companies are here and open for...
More than half of COVID-19 fatalities in New Hampshire have occurred at long-term care facilities. 4 additional deaths were announced today, 3 at Hanover Hill Healthcare Center in Manchester and 1 at Huntington Place in Nashua.
Those are confirmed as of today. That is not recent passings, but as we've talked about before, sometimes it takes several days to get the confirmation of death.
To help stop the spread of the virus at these facilities, the state is partnering with Convenient MD to expand testing for workers. Right now, mobile testing sites will only be set up in Hillsborough and Rockingham counties.
Essentially, this allows us to get about 6,600 additional people tested that are on the front lines of caring for the most vulnerable people in our state.
To provide financial support for frontline employees, Governor Sununu has launched a long-term stabilization program,
which will provide a $300 weekly stipend for frontline workers at New Hampshire Medicaid-funded residential facilities and social service organizations.
The Department of Employment Security will use general funds to pay for the stipends, with the expectation that the money will be backfilled by federal funds down the road.
We're taking action now through Employment Security so we don't have to wait for the federal government to act. To participate, all organizations must agree to pass 100% of all the stipend payments to their frontline workers.
And now those organizations can file an application through an online portal that is set to go live tomorrow. The governor says, to his knowledge, New Hampshire is the only state offering this program. Live here in Concord, I'm Tim Callery, WMUR News Now.
Okay, and there you go on that video and that report. Workers at long-term care facilities in 2 New Hampshire counties to be tested for COVID-19. State officials say testing will determine whether asymptomatic asymptomatic workers infected. Let's take a listen to that video from WMUR News 9.
These are truly challenging times, but New Hampshire companies are here and open for business. The executive director of this new London assisted living facility says 2 weeks ago, COVID-19 test requests for 2 residents were initially refused. And just last week, someone in her own household was sick, their provider saying no twice.
Do you have any recourse? Like, is there anything we can do? And she said, no, I'm sorry, nothing I can do.
All eventually tested, all negative. But it's a process quickly evolving, especially for the vulnerable elderly population. The state contracting with Convenient MD to set up mobile test sites close to long-term care and assisted living facilities in Hillsborough and Rockingham counties to test all 6,600 employees.
If we do those 6,600 people and find out 10 or 15 or 20% of them are positive and they're asymptomatic spreaders, then we are going to expand both the number of times we do that test and the counties in which we're doing the test.
As for the general public, it remains up to individual healthcare providers to decide if testing is necessary.
We want to test to the ability that we have the supplies available. That's includes personal protective equipment. That includes the swabs and the specimen collection supplies.
One way to get someone tested is to send them to Convenient MD. But when we have a regular presence in our community through our mobile testing clinics, either the one that we set up or the one the hospital set up, that is another option.
The state would like to see increased testing for all older people with chronic medical conditions, and those that work with community services like jails, and it will be updating providers with new testing guidelines. Live in Portsmouth, Jennifer Crompton, WMUR News 9.
Okay, and there you go on that video and that report. Unprecedented number of claims leads to unemployment frustration. Granite staters wait for benefits weeks after filing. Let's take a listen to that video from WMUR News 9.
These are truly challenging times, but New Hampshire companies are here and open for business.
Mid-State's healthcare team has been your trusted community healthcare partner for more than 20 years. Now, more than ever, we promise to be here for you, your family, and the entire community. Visit us online to learn more.
We're stronger when we stand together. Help keep New Hampshire businesses and our communities strong.
We are making all sorts of individuals eligible right now that historically have not been.
Talk about a strain on the system. Employment Security prior to COVID-19 averaged 500 calls a week. Now, they average 30,000 a week. Shifting from an earnings-based benefit to a government entitlement?
That cannot be done overnight.
3 weeks. I made a mistake and reopened my claim by accident. And I was trying to get in touch with somebody, and that took a week by the time they got in touch with me. So I missed out on a week.
Some claims are more complicated than others, says Commissioner Lavers, and that can delay a payment. For example, if you use a virtual private network, a VPN, to file your claim, you might get delayed. Why? The system flags those as a potential fraud risk.
The reason for doing that is to prevent people from outside the country trying to fraudulently file claims through foreign IP addresses, foreign bad actors trying to take advantage of benefits from American states.
What about that extra $600 a week? Wendy Bennett is still waiting for hers. Lavers says when it finally comes, it will be backdated.
And we expect by the middle to end of next week that we'll be able to be paying out that additional $600.
We did ask why that hotline isn't open 24 hours a day. The answer is simple, manpower. But Lavers says the website is open 24 hours a day, and yesterday, 60,000 people signed in. In Manchester, Amy Cavino, WMUR News 9.
Okay, and there you go on that video and that report. Sununu says Democrats' lawsuit over COVID-19 funding could put lives at risk. Governor fires back at lawmakers trying to force legislation approval of disbursements. Boston honoring marathon bombing victims with acts of kindness. Let's take a listen to that video from WCBB Boston.
These are truly challenging times, but New Hampshire companies are here and open for business.
Mid-States Health.
Today is One Boston Day, and it marks the marathon bombings that took place 7 years ago. But with current social distancing guidelines and restrictions, the mayor's office is urging everyone to find different ways to honor this day. Since the marathon bombings in 2013, ceremonies and other events have taken place to honor and remember the lives lost and injured. But with current restrictions due to COVID-19, no gatherings will be allowed. So the city is asking everyone to do acts of kindness safely from your home. Some suggestions include check on an older loved one or neighbor, donate to a charity or buy takeout, maybe a gift card. If you're healthy, give blood to the Red Cross or share a good thought, a reflection on social media with the hashtag OneBostonDay. And also today at 2 o'clock, there'll be an online interfaith service. Live in Boston, Sarah Conji, WCVB News Center 5.
Okay, and there you go on that video and that report. And we will share that service that begins at 2 p.m. today, right here on the Riley King Network. Sell-off on Wall Street acrylics as Dow tumbles 700 points. Stocks fell sharply on Wednesday as dismissal economic data and weak bank earnings fueled concerns over the coronavirus's impact on the U.S. economy. Nursing home crises. Federal and state governments are scrambling to provide assistance to senior facilities as death toll among elderly patients with COVID-19 continues to climb. Let's take a listen to that video from ABC News.
This morning, a new fight to help those most vulnerable to the coronavirus.
We're making the assumption that COVID-19 is in most, if not all, of our nursing homes.
In New Jersey, dozens of nursing home residents have died, leading first responders to evacuate the entire facility.
We were barely able to give basic care for our patients at the beginning because of the staffing shortages.
It comes as ABC News learns that 1/4 of COVID-19 deaths in New York have been traced to live-in facilities. In Massachusetts, that number is a staggering 45% of all deaths. The spread there so bad that the National Guard in full protective gear was called in to test residents in this senior living facility.
They should know about this virus. The rest of the world knows.
Deborah's mother died at a nursing home in Washington state where the U.S. outbreak began. She's suing, claiming the facility could have done more to stop the virus.
And they should know better. They should just know better.
But the rapid spread is proving difficult to stop. In Virginia, a single home has now lost 45 seniors to the virus. But many residents have nowhere else to go.
She said, don't, you fight it. Don't go back there.
One nursing home resident in California is set to be released from the hospital after being treated for the virus. But she says she's scared to return to her home.
No.
Why?
Because I don't want to die.
Despite the higher risk, one nursing home director says it is possible to keep facilities free of the virus.
You have a sniffle, you're out for 2 weeks. I'm taking care of so many families, loved ones, and I would want the same for my family if they were here.
And that nursing home is right outside of New York City, making the feat even more impressive.
And just last week, we were telling our viewers that medical experts were saying and warning that if you really think your elderly loved one is in danger in a nursing home or nursing facility, get them out if you can.
Right.
And if they are independent.
But you just said it, if you can, and we just mentioned that there are some people that have nowhere to go. And so it's nice that the federal government is stepping in there.
And it's definitely suggested that you should ask the nursing facility what it's doing to prevent the coronavirus and be aggressive about it because you're fighting for your loved one there.
Exactly.
Okay, and there you go on that video and that report. And that does it for this afternoon edition of the Riley King Newscast, right here on the Riley King Network. Thank you for watching this afternoon edition. Have a great rest of your afternoon. I'll see you back here later on today for another newscast. Goodbye, everyone.